Welcome to Action on Pain, a podcast dedicated to highlighting the significant efforts underway in Canada to address chronic pain.
By presenting perspectives from individuals who live with pain, researchers, clinicians, and other stakeholders, we explore various impacts on people's lives and the initiatives, research endeavors, and the committed professionals working to effect meaningful change.
This work is guided by Health Canada's Action Plan for Pain. Join us as we raise awareness and share stories that are shaping the future of pain management in Canada.
Hi, everyone. Thanks for joining us for another Action on Pain podcast. My name is Keith Meldrum, and once again, I am joined by my amazing co-hosts, Jennifer and Virginia. Those of you who haven't listened to us before, I am coming from the west coast of Canada for this little conversation. I'm located in Kelowna, British Columbia, and it's just always such a pleasure and a privilege to come and have this talk. And I'm really looking forward to today's guest. So, we'll get into that shortly, but I'll turn this over to my other guests.
Thanks, Keith. It's lovely to be here today in the studio with Jennifer and Keith and joining from Nova Scotia. I agree with Keith that this guest we're going to have today is someone that we all know. And I know Keith and myself have worked with him on multiple projects. So this is going to be a great conversation.
That's fantastic. Keith and Virginia, thanks so much. And it's always fun to be in studio with the two of you, and of course to be joined with a special guest. And our guest today, I'm about to introduce him, but I can say that we recently saw each other at the Patient Voice conference, and that was a real pleasure to have seen and spoken with him in person. And I'm excited for everyone to learn about the great work that he does. So today we are joined by Dr. Timothy Wideman. Timothy Wideman is a physiotherapist and associate professor at McGill University. His research and teaching focus is on better understanding and managing pain and pain-related suffering. His work has been recognized through national awards from the Canadian Institutes of Health Research, the Canadian Pain Society, the Arthritis Society of Canada, and the Canadian Physiotherapy Association. Thank you so much for joining us today, Dr. Wideman.
Tim, and thank you so much for having me. It's a pleasure to be here.
It's great. It's always a pleasure to talk to you, Tim. And as Virginia said, the three of us have, a past relationship, and we've worked together on some projects. So it's always exciting to get a chance to talk to you. And with that, Jen has talked about your areas of research. And that's really what we want to talk about today, because that aligns beautifully with goal number 3 of the action plan, which very quickly, that goal 3 is focusing on increasing awareness, education, and specialized training for pain among the public and healthcare professionals. And with that, we know one of your areas of research is on improving training for healthcare professionals. And we'd really like to learn more about that work, what it is you're doing, and really what got you into that.
Yeah, thank you so much. And I appreciate your interest in that. So this is a line of research that I've had the pleasure of being involved with for more than the last decade. And first and foremost, it's very much a group initiative. So I have the pleasure of chatting with you today, but there's a lot of folks that make this work possible. And really a diverse mix of people. So other professors like myself, but also educators, also people living with pain, directors of different health professional programs. And basically the core goal related to it is really directly aligned with goal 3 of the action plan. And it's really to raise the bar for how we're training future health professionals to manage pain, but more broadly care for somebody who's living with pain.
Mm-hmm.
So I can get into the different facets of that, however that it works best for you.
Well, I got a question. I was thinking, you talk about training future healthcare providers. Is that all of them, or is that certain modalities?
Yeah. So you asked earlier about how I got into this, and it's really kind of a direct extension of my background. So trained as a physiotherapist, have some experience working as a physiotherapist. And our focus to date has largely been on the entry level training of physiotherapy, future physiotherapists. So what that means is their compulsory education that they're getting in order to get a license to practice as a health provider. And that's a really fun focus to have, because what you get is everybody. You get a full cohort of students, regardless of whether or not pain is a interest for them or not. And so you can think about, what you want a future generation of health providers to be like, and the values that they might want to espouse, and the skill sets that you're hoping that they'll develop.
That's so interesting. Can I ask quickly, when you meet those groups, how aware are they as a whole of the prevalence of pain and of chronic pain in Canada?
It's a great question. And I think, so I also, as on faculty at McGill, we kind of do admissions. And so every faculty member has a role to play in this. And I've maybe only seen a handful of students that mention, chronic pain as part of their admissions application. The typical pathway is, I had a sports injury, and I really like my physiotherapist, something like that. Very few of them identify chronic pain. There are some, but it's a small minority.
Interesting.
And so part of my job as an educator then at McGill is really to kind of pique their interest and trying to, validate the skill sets and focus that they have, but maybe expand that to include folks with chronic conditions and chronic pain, certainly.
It's fabulous.
I got a two-parter for you, Tim.
Yeah.
So what was your motivator to focus in on this work? So you were trained as a physiotherapist, experience practicing clinically. So I think everybody would be interested in hearing, what was that thing that sort of drove you to do this? And so we'll start with that.
Yeah. So I had a bit of an interesting path to becoming a professor, and it went through psychology. And so my work is kind of at the interface of physiotherapy or physical rehabilitation and psychology. So I did my PhD in experimental psychology, just means research psychology at McGill University, and very much kind of combined, the training that I had as a PT with some new research and innovations in the area of psychology of pain. And that really stemmed out of gaps that I was seeing in my training and when I was practicing, is really like, what's so important in chronic pain rehabilitation is really being able to see the whole person. And I think our training is really good at focusing in on the muscle and bone and soft tissue aspects of injury, and really good at helping folks recover from that standpoint. But as you all know, there's a lot of complexity when that recovery doesn't happen perfectly, when pain sticks around. And we know that the psychology of living with pain is a massive part of that experience, and something that a physiotherapist needs to know about, and they need to have that kind of skill set. And so a big part of my motivation in doing research was to kind of bring in that aspect of the pain experience to physiotherapists, and then the focus on education, which came after my training, really just stemmed out of those gaps, and kind of trying to think about, where would my biggest bang for buck be? And again, thinking about those cohorts of students that we're churning out every year, and trying to think about building up capacity so that we could imagine a new generation of clinicians that would just, be a lot better prepared than my generation when I first graduated as a physiotherapist.
That's fabulous.
I agree with Jen. That is fabulous. Was there something in your life that made you sort of clue into this, that it's about whole person care? Or, I mean, I have the privilege of knowing you. We've worked together for almost 6 years now. I think you're a very empathetic and caring person. So was it your personality, or you just looked at this? I was trained as a manual therapist to help and fix people, but I see there's this gap. Was that just you seeing that this didn't align with what you felt was needed?
That's a good question, Keith. And this is the second part. The second part's harder than the first part.
Well, I thought it would start easy for
you. You might be better positioned to answer that than me. But I think part of what really kind of intrigues me about pain is the fundamentally idiosyncratic nature of it. Is that hey, you could have a room full of people that experience chronic pain, and what that means and what that feels like for each individual might be different and might be totally different for individuals. And I think that's something that's always intrigued me. And probably probably links into a bunch of things about like who I am and my background and stuff like that. But that's a big part of what I want to convey to students is I really want them to help see the person first and foremost, who's living with pain. And I really want to help them understand what it means for that person to live with pain. And that starts with, what does it feel like, of course, but then a big part of that is, what is the impact that pain has had on their life? And I think that gets at some of the root goals and root directions for what you can do as a health professional to help that individual.
I think you're, yeah, I think
Intervention
you're onto
really,
something, Tim.
yeah.
Just saying that so many people in a room, but it's all different, for them and for the healthcare providers to know that. I chimed in there is I'd like to, I know your work. So it'd be really nice to your listeners, like, how are you delivering that message to your students? And I know some things you do, so I'm hoping you'll kind of bring some of those things, like how they're really understanding the person that's threatening that's on them and the impact of the chronic pain on the person.
Yeah, well, thank you for that. That's a great question. And really, what I'm trying to do is to kind of layer experiences with the students and thinking about when they first come into the program, and then when they're finishing the program. And I have the luxury of having these little inputs at McGill throughout their training, and all of my teaching. I'm very privileged that I get to focus on this subject that I really care about, and so I teach the whole curriculum related to kind of chronic complex pain for McGill students. And where I start with is I start with their own experiences, actually, and that might not be so obvious, but one of the ways that I think about education in relation to a health professional is like, well, a big part of what we believe about pain or how we understand it is probably anchored to how we interpret our own experiences of pain. And so I start with them describing in just a kind of fun classroom activity their worst pain experiences, if you want to imagine that as being, as an educator, I need to imagine that as being. But we basically, have them talk about their worst pain experiences, and then we kind of unpack those experiences. Hey, what was going on with your body? What were you thinking about? What was your relationship with other people around you? And then we talk about these in class, and we kind of build out these kind of biological, psychological components of their own pain experiences. And then it becomes really natural for them to kind of think about these different dimensions for not only their own experiences, but other people's experiences as well. Then I go further. That's one layer. Then I go further and I do this kind of what I really like. It's called a pain experiences workshop or laboratory. And then I bring them into a lab and basically poke and prod.
Great idea.
This is fully consensual. And basically, we'll do all kinds of really cool experimental paradigms that we use in research a lot, but with the students. And so that'll mean we'll kind of poke them and record, what the response is to that. And we'll use these different paradigms. And we record all of that data. And then the next day, I bring it back to them in class. And it always, every time, I have maybe 60, 70 students in my class every year. And pretty much every time we'll get these really nice bell curves where everybody will have the exact same input. Let's say I ask people to immerse their hand in 2 degrees Celsius water for 20 seconds. It was a standard kind of research paradigm. But you'll have people that will record that as 0 on 100 in terms of pain intensity, and then all the way to 100 on 100 in pain intensity and everything. And I always love the students' reactions when you show them that graph of people that they know and trust, and they look around and they're like, wow, you had a totally different reaction to this than me. And I think that becomes this layer where somebody that they know and trust and have a relationship with, they can have some room to imagine that their experience of pain is different from theirs. And that then becomes this foundation for thinking about, again, these idiosyncratic experiences that people now who have chronic pain and maybe have a very sensitive nervous system have pain experiences that are very different from the clinicians that are treating them. My hope is it gives them a foundation to kind of think about those experiences as valid, but different experiences from their own. And to help that along, another layer is that this activity that the Virginia been a leader in recent years is basically where we bring folks who are living with chronic pain from around Canada into conversation, into these kind of really in-depth one-on-one conversations with these health professional students. And so we do this online, and we have these interview guides that have really been co-developed with people who are living with pain. And they're basically themes where folks who are living with pain, they say, hey, this is really important for my future health professional to know about what it means to live with pain, but is often overlooked. And so they have this kind of 1 hour conversation about these different things like stigma and pain, or like mental health and pain.
Mhm.
So it seems to broadly relate to kind of how we would think about suffering related to pain and experience of pain. They have these one-on-one conversations with students. And I find that that's a really huge turning point for students, where then all of a sudden, coming out of those conversations, they can really have a beginning of understanding what it means to live with pain. And for me, that's a huge foundation then of kind of layering in these skills and strategies that we know about from research that are likely going to help folks with chronic pain.
There's a couple of things you said here, and you said you want students to first and foremost see the person.
Mm-hmm.
And I think that's huge. And I think that then goes into your experiments where they see people they know and trust. And I think, without getting too sort of political or negative, often we see in these encounters, in the clinical encounters, is the therapist doesn't really trust the person in pain because they don't really believe them.
Mm-hmm.
And so when they have an opportunity to see their cohorts who they believe and trust because they're going to be professionals as well, I think you're starting to layer that all-important foundation.
Yeah. That is really part of the intention there, is to try to, I think there's this dynamic of othering that happens with health professionals, and particularly, I think, folks with chronic conditions and folks that we know, with chronic pain, stigma, being dismissed, being invalidated, that these are huge parts of the experience of pain, unfortunately. And part of the intention with these teaching strategies is to try to develop a relationship with that person with pain. And that's the work that Virginia is involved with, and others. And part of that is to, stop seeing this person as somebody who's totally different from them, and start seeing them as another human that deserves compassion, that deserves care.
Yeah, I absolutely love what I'm hearing in terms of the approach that you're using with your students. I think about, I suppose human nature. I can't help but parallel that to perhaps some of my own experiences, and, sense of, stigmatization, othering, as you mentioned, that happens, whether it be the individual practitioners or it be people like in your circle who just have no capacity or understanding or ability to understand, what this thing means. And why is it that I can't see it on them, but they are experiencing something that's quite significant and life-changing for them. So I really, really appreciate that, because I just think we're in for I'm imagining kind of waving a magic wand where all healthcare practitioners have this level of insight and bring that to the table, just like every patient who walks into the room brings a backpack full of their life that comes with them. And so understanding who they are as an individual to the extent that is possible within an appointment time, and bringing that understanding. So thank you for the work that work. Just really appreciate it.
Thank you.
Yeah.
Thank you. I appreciate that.
And I think, and you touched on one of the things that this leads into, and we're not going to have time to get into it in depth, but it does touch on your other work in pain-related suffering. And it's all, the backpack experiences that Jen talks about, and not being seen as a person and not being trust. That all adds to, a person's suffering as they live with pain. And I think that is often completely missed in a clinical setting.
Yeah, I think the way that ties in is the training often for primary care providers. So we're thinking physicians, nurses, PTs, etc., is on these kind of signs and symptoms and diagnosis. And it's a big important part of learning to manage pain. If somebody has appendicitis, pain is part of the differential diagnosis, and that's a really urgent thing that you need to navigate. However, there's this other part of living with pain, day in, day out, that is often overlooked when it comes to health professional training, and that suffering bit that you're learning to, like how pain disrupts your life, and how it disrupts the things that are most important to you. That's a huge part. I don't need to tell you, 3, that's a huge part of living with pain and often not focused in our health professional training.
Mm-hmm.
And what I want to just mention is, the strategies I use at McGill, that's one piece of it. But the research, the focus of the research primarily is really to try to come together across all the PT programs in the country and we've successfully kind of created consensus on, what should the goals of entry-level training be in terms of competencies in management that we want clinicians to develop. What are the strategies that we want to use in terms of strategic plan? We've reached consensus on that. We've done some really important surveying work just to kind of understand the landscape of what's happening right now in PT education. And then we also just recently, it's still not published yet, but we did this really exciting project where we evaluated competency across nearly all programs in the country. So we're talking more than 600 students kind of completed this really comprehensive assessment.
Impressive.
And so what we're able to see is kind of these relationships between, okay, what are the drivers? What are the differences maybe across the country? And then also what are the drivers of those differences and how well students are prepared to care for folks living with pain. And one interesting thing that came out of that, just is maybe stealing my thunder when I published that.
Stay tuned, folks.
You heard it here first.
I like that. It's not the things that you would expect. So in our analysis, we were expecting to see the amount of time dedicated to pain in the curriculum as predicting how well students were prepared. And then that wasn't a predictor. What was a predictor in some of our kind of additional analyses was whether or not somebody who is living with chronic pain was involved in curricula. And folks that did involve people who are living with pain in curricula were graduating students that were showing higher levels of competency. And so some of the work that we're really excited about doing now is taking those interventions which I described earlier, which is integrating people who are living with pain into these conversations with students, trying to run that at other programs. So we hopefully have a chance to do some pilot work in this area, trying this intervention with other programs and trying to see if that's something that again helps further prepare students to care for people living with pain.
Amazing.
I mean, really, it's not a shocker to say who would be better prepared. I mean, it's good to have the evidence, but I think we're all not surprised by that.
Yeah, it's the kind of thing that, I agree with you, Virginia.
And on that note, so once this is published, and again, you heard it here first, folks, once this is published, there is that opportunity to really further add to all the patient engagement work, other patient engagement work from a different perspective that's happening, right? To help people see, those who are in these roles, help them see just what that value is, that value proposition of having a person living with pain part of this. So
yeah, it's exciting findings because, if we come back to goal 3 in the action plan, this is some important data where we have this standardized competency assessment, super comprehensive. People living with pain help create it. And then we have that data across nearly all programs in the country. And that's kind of unprecedented, not just in Canada, but around the world. And so what it means is that it allows us a lot more precision and nuance. And then how we can kind of further tackle that goal in the action plan of better training health professionals in the PT sector, but then also other professions as well.
I think that's amazing. And I think this is probably a great place to end the conversation, but I think it leaves us wide open for more conversations in the future and other topics, because I think there's a lot that needs more to be unpacked and see what gets published and bring you back again. But Tim, it has been an absolute pleasure to have you in our studio and hear all about what you're doing.
Thank you so much. And thanks for your interest and support. It's been lovely to chat with you all.
Oh, we appreciate it greatly. And we'd also like to thank all of you for tuning in to the Action on Pain podcast. We hope this episode has shed some light on the important work being done in Canada as guided by Health Canada's An Action Plan for Pain in Canada. Until next time.
Thank you for joining us today on Action on Pain. If you enjoyed the discussion, please follow us on your preferred podcast platform to stay updated, and please share with your networks. A 5-star rating and review would help others find our show. Your feedback is important.
This podcast does not contain any medical advice. Please consult with your doctor if you have any questions or concerns.
The Action on Pain podcast is made possible by the generous support of the Chronic Pain Network, a national research and knowledge mobilization network.
The views, opinions, and content shared by hosts and guests are their own and do not necessarily reflect those of the Chronic Pain Network or its funders.